Good evening to you all, wherever you're watching Bethany TV from. Welcome to our next episode of Medical Minds. In today's show, we have our topic, and we are basically going to look at fertility treatment options. Just in case you're there wondering what it's all about, Doctor is already in the studio to give us all the answers. Welcome to the show. Welcome to the show once again. This is Medical Mind, and we are going to look at fertility treatment options. We've been looking at different topics from the time we started, and we did not look at how to treat infertility in both men and women. So today we've decided to look at that topic, and Dr. Anderbat is back on the show to give us all the answers that you've been looking for. Welcome to the show once again, Doctor.
Yes.
Good evening.
Good evening.
Welcome back.
Thank you.
How was your new year?
It has started well.
What happened to the Skyping? We were here and everybody was waiting.
Oh, you know, network.
Network
I was in
issue.
the village, you know.
Oh, really?
Yes.
It's okay. Welcome back.
Yeah.
Yes, say hello to the viewer.
Yes, good evening, viewers, and welcome to the show.
Thank you so much.
Thank you.
Doctor, we go straight to our topic, and we've been looking at infertility in women, in men, and we've not been giving them a way forward as far as that is concerned. Yes, and this is exactly why we are here today. Before we go into the treatment options, kindly remind us briefly what infertility details.
Yeah, so infertility, just to recap, when we talk about infertility, we mean that the couple has been trying to conceive without using any means of contraception for about 12 months, and they are not getting the pregnancy that they are looking for. Yeah, in the basic terms, that is what infertility is. As you can see, it is a problem, and previously we discussed a bit about the causes and some different aspects of infertility. So, because the biggest interest is to try and solve the problem of infertility, and so today we will just briefly outline, because the methods of treatment are quite numerous, and this is a whole pressure. We will discuss this briefly, and then we will later dig deeper.
Thank you.
Some later shows.
Thank you so much, Doctor. Do we have types of infertility, or it's just one?
Yeah, okay. So in terms of types, depends on how we, in clinical practice, depends on what we are looking for, because we can classify them according to their causes. We can classify them according to whether somebody has had a pregnancy before, now they're not getting. This is the commonest. So we broadly can classify infertility into primary and secondary.
So which one is the primary?
So in the primary infertility, that means the person has not had a pregnancy before, and now they are looking for a pregnancy and it's not coming.
They can't get the baby, yet they've never given birth.
They have never given a birth before.
Okay.
Yes. And the secondary infertility, they have had a pregnancy before, whether it resulted into a baby or it ended up as a miscarriage, but then now they are having challenges with conceiving.
Okay.
Yeah, so this is the difference,
Oh,
primary and secondary.
Okay.
The definitions, the differences have some clinical implications. Yeah, but these are the two broad categories.
Okay.
Yeah, and then we can also talk about according to the causes of infertility, for example, tubal infertility, male factor infertility due to sperm problems, or infertility resulting from a problem with the womb.
Okay.
Yeah, so those are how the ways in which we can classify them.
Can classify them.
Yes.
Those two of the two types, Doctor, which one is more common of late?
We are seeing more commonly secondary infertility, actually. We're seeing secondary infertility common. At some point, they were balancing, but now we are beginning to see secondary infertility being more common. Somebody has a pregnancy before, maybe it ended up as a miscarriage, but now they're having challenges with conceiving.
They can't.
Sometimes they are not, the couple are not, especially the lady is not volunteering the story. But if you dig deep,
so sometimes we keep away the secrets,
and
we keep thinking it is the man.
Yes.
Yet we know in our previous years
something
what we did.
there.
Surely,
yes,
true,
yes.
True. Which is very important, because when you hide away that factor, there is no way.
And then you may take long to be helped.
True.
Yes.
Thank you so much, Doctor. Let's go straight to our causes of these different, these primary and secondary, before we look for the symptoms out.
Yes, yes.
Yes.
Yeah, actually that's a very good highlight for us to start with, because the main discussion today is the treatment, but the options of treatment are based on the causes. So it is important to briefly outline those for sure.
Okay.
So in terms of the causes, broadly, infertility may result from a problem in the man, or it may be a problem in the woman, or it may be a problem in both. On the side of the man, usually it is a sperm issue. Either the sperm count is low, or the sperms are not there at all. Yes, so there's an issue with the sperm. That's usually one of the issues in the men.
Okay.
But now on the side of the women, it can be something to do with the tubes. The tubes are either blocked.
That is the primary, when the lady had never conceived at all?
So
Or
all these causes can happen.
across.
Yeah,
Okay.
all these can happen in the primary case or in the secondary case.
Okay.
Although some of them are more common in the primary, and then there are more, others are more common in the secondary.
Okay.
But in terms of the causes, usually we look for the same causes. Whether it is the primary one or it is the secondary one, we look for the same causes.
Okay.
Yeah, so it could be a problem of the tube, or it could be a problem with eggs. The woman is not having eggs, or the eggs are of poor quality, or it could be a problem with the womb. Some people have had the wombs injured, and so the womb cannot hold a pregnancy.
Due to infections,
yeah,
different
due to infections, due
abortions.
to surgeries, due to abortions, and so, yeah. Some people are born with abnormal wombs.
Oh,
Congenital
really?
abnormalities of the womb, we are also beginning to see them.
To discover it.
Yeah, somebody
late.
has something like a curtain, or we call it a septum, dividing the womb into two parts.
Into two parts.
Unfortunately, that septum does not have enough blood supply. So if the baby attaches there, it won't be able to grow.
Okay.
And if that happens continuously, and then the person may not have a pregnancy.
Sorry.
Yeah.
Doctor, before we look at the symptoms for any mother or father to look out, we've had issues where mothers take so long to conceive after using family planning. What's the theory behind that?
Yeah, so family planning, if it's used correctly, shouldn't cause a problem, because there are some family planning methods which are temporary,
Okay.
others are permanent. And before somebody gets onto any particular method of family planning, they should have that information
They
and
should
make
be
a choice.
sensitized.
Yes, they should be knowing that this one, the one I'm taking on, is not going to be reversed, or is going to be reversed. And if it's going to be reversed, it is going to be reversed immediately, or it may take some time. So basically, if we have the right information, we should not be accusing family planning.
To be helping us to make.
Yeah, we should not be accusing family planning methods for infertility.
Thank you so
We
much,
shouldn't.
Doctor. There is a parent, a lady who was asking me yesterday that does family planning comply with blood group? That please ask doctor, because sometimes we go for these things when we don't know that this one works with my blood group or not. So I was like, fine. And she's watching. She wants to hear that. Yes.
Oh yeah. So that's actually that's a very, very common question people ask.
Okay.
It's a very common question people ask, and the answer straight before I go into the details is there's no relationship between blood group and the type of family planning you can use.
Okay.
When you're choosing a method of family planning, there are different factors we do consider. One of them maybe is how many children you want to have, for how long you have to have this family planning method, whether you have other diseases like heart diseases, blood pressure, or diabetes. Those are considered, yes, but it is usually not related to the blood group.
And yet sometimes we keep quiet about our medical status. We don't say it when we're taking this family planning.
Yes, so that is that is very, very true. So for blood group, no.
There's nothing.
There's nothing related to the blood group. We know, I hope we know what we mean about blood group. Blood group, our blood falls in groups. We give them names.
Yes.
Blood group A, blood group B, we have blood group AB, and then we have blood group O. And each one of those may either be rhesus positive or rhesus negative. So your blood group comes out as A plus. That means it is blood group A, rhesus positive. Or it comes out as B positive or B negative. So that's how blood group comes.
Okay.
But it has nothing to do with the method of family planning that can be appropriate.
Thank you so much.
Yes.
Let's look at the symptoms that, especially a woman, let's start with a mother, that a woman can look up to and know infertility is closing my door. Yes.
So basically, infertility by itself, in most cases, they do not have like any other symptom. What actually can be a symptom is the underlying cause of the infertility. But infertility is defined by the time period. We only define it based on how long these people have been trying to conceive. Yes. And so that's it. So we cannot say this is a short person who is going to have infertility, is a tall person, or is having headache. No, that it doesn't work.
Okay.
But otherwise, some of the causes of infertility do have symptoms.
Okay.
For example, endometriosis can affect the tube, and it can present with painful periods. So if somebody is having a delay in conceiving and also has painful periods, you may think that they have endometriosis, which is causing the infertility. Yeah, but infertility is defined only by the time period in which the person is not able to conceive.
Okay. Thank you so much, Doctor. I think you've got the answers right from Doctor. Infertility or family planning does not match with our blood group as a mother. You just need to be open and tell the medics who is going to administer your family planning. You tell them whether you have any underlying medical condition like pressure, this and that, so that they can advise you accordingly. Otherwise, I think it is safer. Thanks so much for joining us. Once again, this is still Medical Minds, and we're looking at basics of fertility treatment options. Doctor, who is eligible to fertility treatment? At what age can you really say this person needs treatment?
Yes. So now with the recent articles going on, I can see that top question is a bit political, but it is fine. Well, anybody desiring to get a baby is eligible to fertility treatment. Now, the option of the fertility treatment will depend on a number of factors. Yeah, but anybody who is desirable of having a child
and that failed, that tried and failed.
Have tried and they're not conceiving is entitled to get fertility treatment.
After taking all the options, after checking up, seeing the sperm counts, things are not working out, you can now say, much as you are young, you're only 25 years old, you deserve this. That is very good. Thank you so much, Doctor. Yes. At what stage does one need to start treatment, really?
Yeah, so usually if the couple has been trying to conceive for 1 year and the pregnancy is not coming, they should go and first have assessment. Now, based on the assessment, the health workers the fertility experts should be able to say yes. There are some cases where you can say no, you can hold on for some more months. Okay, yes.
You still show some positive...
Yes, you can still conceive on your own. Maybe there were some few things that needed to be fixed. For example, timing, maybe you're not... some people don't stay together, they're having meetings only on the weekends.
Once in a month?
Once in a month, somebody is staying in Juba, another one is in Uganda, and like that. So you may not be able to time very well. But let the health worker see if this will be suitable for you. But then he can also go ahead and say, okay, maybe you need some other forms of treatment. Okay. So we have a myriad of treatments which are available. Okay. And these should be decided according to the situation, based on the identified cause. It should be also be based on other factors like age or how long the person the couple has had infertility. Yes.
Okay. Yeah. Thank you. How long does that treatment last before someone conceives?
So fertility treatment, as we will talk a bit about them, there are a number of them. It's not only one. We have a number of them available. Some of them take a short time, others take long. Some can last as short as 2 weeks, others can last even 2 months. Sometimes it is even longer than that.
Even a year.
Even a year. So sometimes you have to fix some things first before you go to the final treatment.
You just first have to know the cause,
exactly.
I think. So that gives you the best
Exactly. You should know what your situation is, what journey is going to be suitable for you, what you have embarked on.
Okay.
Yes.
Doctor, what if we have a couple that have tried all the treatment options for years now, but still they failed to get a baby? Is there any other option or hope for such a couple, really, if they've done all? I think they went for treatment for about 4 to 5 months. They kept on trying, praying, but still up to now, so far now, 7 years. Could there be any other possible solution?
Well, it's hard to tell what could be happening. As I told you, there are different treatment options available for infertility, which I think we may have to mention a bit. But broadly, the approach to fertility treatment, there are 2 approaches. It is based on the concept that if a couple is failing to conceive and then you have identified a problem, okay, you could opt, you have identified, for example, it's a tubal problem. They are not conceiving because of the tube problem, or they have an issue with the sperm. You could decide to correct that. Okay. So the approach could be correction. You want to put things back in order so that they can conceive normally. Another option is you say, okay, this obstacle you're having, I may not be able to correct it, so I can bypass it. So we have technology to bypass that. That's when the concept of IVF... You build another road. Yes, you build another road instead of...
Going straight to you.
Exactly. Okay. So this is again, of course, dependent on what the problem is. Okay. And as I mentioned earlier, there are some people for whom you can actually comfortably say that, you know what, you can hold on. You could conceive naturally on your own. Because fertility treatment is expensive. You want to really do it when it is necessary. True. Yes.
True. Yeah. True. Thank you so much, Doctor. Let's look at the treatment options. Do we have any illustrations so that we can say exactly what we could be treating?
Treatment options, I think we can look at the...
You start with women?
Yes, so the treatment options, we can look at briefly like this. The treatment options depend on, first of all, the cause, what is causing the fertility problem. One of the options which you should not forget is no treatment. No treatment is a treatment option. Because if you have done all the tests and you identified no problem, or the problem is such a minor problem, for example, maybe they are not meeting very well, they are not meeting frequently enough, or it's something to do with the stress, you can tell them that, you know, if you sort these things out, they get cancelled, give them some time. Most people in that category will be able to conceive within like 2-3 months. Okay. Yes. But in some people, you have to, of course, again, depending on the cause, if it's a problem of ovulation, there are certain conditions which affect ovulation. For example, PCOS, somebody is not having frequent ovulation, you get medications to help them ovulate, to release eggs. Okay. Yeah.
Yes, there's something
if we will look at that when we do at I think the IVF options. So it could be something to do with ovulation. You just have to induce the ovulation, the egg is released, and that's the problem sorted out. Okay. Or it could be a problem with the tube, and then if it's the problem with the tube, you could correct it with
you create another path, like you've said.
Yes, or you can use another path, that is you do IVF for it. Yes.
Okay, that is IVF.
And then sometimes we can do insemination. So we can look at those options in details, one by one.
Okay.
Yes.
Let's start with insemination.
With insemination, yes. Okay. Yes, so we have a simple illustration for insemination over here. But to start with, insemination basically means what you're doing is you are getting the man's sperms, you are cleaning them up, concentrating them, and you are putting them into the woman's womb at the time when she has ovulated. This concept is borrowed from animal husbandry. Oh, yes. Yeah, sure. They do the same. Farmers do the same thing for animals when they are doing breeding of animals. Yes, so we borrowed that from them and we are applying it successfully. And it works successfully? It works, yes.
After picking these sperms, doctor, do you first treat them or you just bring them there directly?
No, okay, when you get the sperms, you clean them up. Cleaning is you separate them from the fluid where they are. So we have laboratory techniques which we use for separating the sperms from the fluid where they are being released in. And then there they will be clean. Then in the process, you also activate them because initially the sperms are moving slowly. And so if you take them through the processing, they will be moving strongly and faster.
How long does that take?
The preparation?
Yes.
Maybe an hour or so.
Just
the preparation. So the preparation is an hour. So the whole treatment of insemination, although it is referred to as insemination, it has some preparation first. For example, commonly you start with giving the woman some medication because you want more eggs to grow and you want the eggs to really be released to increase the chance of them conceiving. Yes, and then that takes like about 14 days. So you keep on checking to see that the eggs are growing. And when they are mature and they have been released, that is the day you will get the sperm from the man and prepare it.
So in this case, doctor, when we're using artificial insemination,
yes,
who could be carrying the problem? Could it be the lady or the man?
So yes,
or both.
So that's a very good question. For what indication do we use artificial insemination? Artificial insemination, the indication is quite interesting and it has been evolving over time.
Okay.
Sometimes if the couple are unable for some reason not to be together, in the time when the lady could be fertile, we can do that insemination. Maybe the man is abroad and is only coming in December and they want children. So he could leave his sperms here and we do insemination, artificial insemination for the woman.
Okay.
But artificial insemination is also suitable for a couple where you've done all the tests and there is no problem, but they are not still conceiving after 1 year. Yes, because some of the causes of inability to conceive are not easily identifiable by the tests. For example, it may be a problem in the cervix. The cervix is too tight and it is not allowing the sperms to pass through.
Okay.
Yeah, so that's one of them. Or if it's a problem of the tubes, but it's a mild one, which can still allow the sperms and the eggs to move around, you can still do insemination. So you increase the number of eggs by a medication, and then you go ahead and do the insemination.
So
insemination has a lot of applications.
A lot of applications,
yes,
and illustrations for us to learn from. But the basics you've given us.
Yes, another thing about insemination which we used to practice a lot, it is now reducing, but I think it might still have to be reintroduced, is discordant couples. HIV discordant couples, where one of the couples is HIV positive, and the other one is not. Because normal sexual intercourse would increase the risk of transmission. And so what we do is we do insemination because we can get the sperm. If the man is the one who is HIV positive, we can get the sperm and through our preparation, and we know how to prepare it if it's HIV sample. Yes. So we are able to remove all the viral particles and prevent transmission of infection. Okay. Yeah, so it used to be quite popular. Yep.
Thank you so much, Doctor. Yep. That has been artificial insemination. Insemination. Yes, and it's one of the ways that medics treat infertile couples so that they are able to have a baby. Doctor, let's look at IVF. Yes. Yes.
IVF, yes. So IVF, to start with, IVF is like the core of the fertility treatment. Most other forms of fertility treatment, which we call advanced fertility treatment, are derived from the concept of IVF. Now, IVF in full is in vitro fertilization. In vitro is in a glass. In the glass. Fertilization is happening in the glass.
In the glass. Oh.
Yes, that's what it means, literally. Doesn't mean we have these no usual cups there. No, the lab has specialized glassware, which we use. There are tubes, there are dishes, which we use for carrying out fertilization. Okay. So because fertilization occurs in a glass, then we say in vitro fertilization. Okay. Yeah. Okay. So IVF. To start with, the primary concept for IVF is really to overcome a tube problem. That's the commonest indication for IVF. The woman has blocked tubes and you are unable to correct it. And that is when you talk about IVF. But it has steps. Maybe I will have to explain. Yes. In vitro fertilization, there it means we're just talking about one part of the process, fertilization. But it's a longer process. It has stages, about 5-6 stages. Okay. Yes, which we can refer to in the illustration.
Okay. So during that IVF, the baby typically grows in that bowl.
In the glass.
In the glass. It's not transferred to the mother, which stays in that container throughout?
No, the baby grows eventually in the mother. So let's look at the stages. We just have to look at the stages. Yes. So the first stage of IVF is, just to illustrate here.
Do we have an illustration?
Yes, this is actually the steps of IVF.
Oh, okay.
Yes. So for step one, step one is to stimulate the woman to grow eggs, because naturally the body is tuned to produce 1 or 2 eggs per month. But for process of IVF, we need more eggs. So what we usually do is we give the woman some medications. Most times injections. It may be injections mixed with tablets. Yeah, so that goes on for about 14, 16 days. Okay. And we are monitoring how the eggs are growing. So we are doing medication, and this is step one. When the eggs, all this process starts when you have already done the investigation and you know this is a suitable treatment for them. Yeah. True. So you have this step. In this step, you will have your eggs now ready. Okay. Remember, these eggs are growing in the ovaries.
Of the lady.
Of the lady, yeah. So they will be growing inside and you are able to see them with a scan. Yes. So when they are mature, you remove the eggs. That is step 2. Oh, you extract it out? Yes, you extract it out. This is a very good illustration of how it is extracted. And it's people always ask, now my tubes are blocked, how do I get the eggs out? No, they don't have to pass through the tubes. For example, this is the ovary, the eggs are inside here, the tube is here, okay? Now, this is a specialized ultrasound scan which is put inside the woman's vagina, and it carries a needle on it. Okay. Yes. Now, with this needle and that ultrasound helping to see where the eggs are, we're able to suck out the eggs and they come into the tube. So we call this egg collection or egg pickup. So that's step 2. Okay. Now, once the eggs are removed in tubes like this, they are poured onto this and they are checked out. And you see about which one. You see the eggs, yes, you really see them, and it's very interesting. Really? You see the eggs as they are, you pick them up, you wash them up, and you see which ones are mature, which ones are not mature. Now, at that stage, what you do next is it will be preparing the sperm as you are sorting out the eggs as well. Okay. Now, depending on the status of the sperm here, you can decide how to achieve fertilization. Now you will be having the eggs, you'll be having the sperms. So you will decide the eggs and the sperm. So you will decide how to achieve the fertilization. That takes you to stage 4. Okay. Yes. Now here, sometimes the problem is purely only the tubes. And so eggs are okay, the sperms are okay. You just bring them together. So we have a machine called an incubator. Okay. So once they are brought together, you put in the incubator, and then the sperms will be able to fertilize the eggs, like how they would have happened in the tubes. Exactly, inside, yes. Now, yes, so sometimes the sperms are too few or they are too weak, and so by themselves they may not be able to enter the eggs. Yeah. So in that case, we have a more advanced technique where we have to pick a sperm, catch it in a needle, a specialized needle, and you inject it inside the egg. Yes. Wow. That's where we call ICSI, intracytoplasmic injection. Okay. So that decision is taken here and it takes you to stage 4. The 4th stage, yes. Okay. So you would have achieved fertilization. And then from the fertilization, you will have your embryos, yes, which is the stage 5 here. So like the common practice, we usually do the transfer after 5 days. So you will have your embryos, you know fertilization has occurred, the embryos are growing. Then you pick the number of embryos you want and you put them in the womb. You take it back to where it's supposed to go from. So in essence, you have bypassed the process which would have needed the tube. So all these things were supposed to happen in the tube. Yes. and so now you put back.
That's a very beautiful illustration.
Yes, so that's the basics of IVF.
Okay,
yes.
Thank you so much. It's still Medical Minds, and we're looking at treatment options. Doctors really illustrated, and I think we've got all the essays very well. We're going to have a very brief break, and when we return, I think our lines will be open. You'll be able to share with us all your stories. You'll be able to call the doctor and ask him that burning question that you've been keeping for him. Stay with us, don't go away.
Bethany TV for health. Exciting news for all viewers of Bethany TV. Bethany TV, the premier health TV channel in Uganda and Africa, and also your favorite TV station, is now on Star Times. You can now watch Bethany TV day and night, weekdays and weekends on Star Times, channel 271. Catch your favorite programs on health, wellness, entertainment, and so much more. Bethany TV is also available on free-to-air, GoTV, YoTV, Airtel TV, and Afro mobile apps. Not forgetting online via our website www.bethanytv.ug and social media platforms at Bethany TV UG. Bethany TV for health.
Introducing Disney Junior and Daycare Center, a school that will guarantee your child excellent education. The school has professional and competent teachers who will take good care of your child. Disney Junior and Daycare Center at Natete has conducive and comfortable environment for your child. The dine is just right for your child. And transportation is well catered for. They have vans and qualified drivers. Look nowhere for your children's education. Bring them to Disney Junior and Daycare Center at Natete. Disney Junior and Daycare Center for a firm foundation.
Are you ready for this good news? You can now watch Bethany TV on YoTV, Afro Mobile, and Airtel TV apps. Yes! Catch the finest programming prescription for everybody, wherever you are, whenever you are. Bethany TV for health. Are you looking for a platform to advertise your business and boost your sales? Bethany TV got you covered. Take advantage of our introductory rates and maximize your leverage for brand awareness, advertising, product launching, live coverages, activations, and so much more. For booking and more information, contact our sales team on 0785 576 269. Bethany TV for health.
bulijjo enkulaakulana etandikira mu nju yo n'efuluma n'ogirabira ne mu bikwetoolodde n'omwana gwewadde omusingi omulungi ogw'okusoma oba omuwadde future entangaavu abazadde muwonye ekipya kiikino ezanta mu tawuni mu maaso g'eggombolola nga yendejje Excel Junior School lisomesa abaana okuva ku nasale paka mu primary 7 somero ddungi ate nga linyirira abaana balya bulungi balanced diet lirina abasomesa abalungi ate nga bakugu twala omwana mu ndejje Excel Junior School afune future okumanya ebisingawo essimu not musanvu not 3 not ndejje Excel Junior School achieving excellence together.
Showing on Bethany TV. Have you gone through a dire health situation where people imagined you could never come back from? Or do you know of any person who overcame a life-draining situation? Inspirational stories, motivational journeys, predicament after predicament. Winnie Babazi dives deep into their roller coaster experiences, but most importantly, how they overcame. Don't miss Be Hopeful, featuring medical experts' advisory on every experience shared.
Your story can inspire, encourage, and give hope.
Mondays and Tuesdays, 9 a.m. Bethany TV for health. Bethany TV for health.
Welcome back from that break. We are still discussing fertility treatment options with Dr. Underbart. And before we went off, he was trying to give us all the process that takes all the time for one to achieve a baby using IVF. So, Doctor, you had already given us all the illustration. My inquiry is it 100% that after all this process, someone can get a baby, or sometimes it fails?
Yeah, that's a very good question, and it's a common question. Sometimes it fails. Yeah,
after all this process?
Yes, sometimes it fails because science in this field has gone very far. But as you know, science is relative. There is still some information also missing, but also sometimes there are some problems related to the process. For example, some people's eggs are not good quality, and so the end product, for example, the embryos will not be good, and their chance of attachment will be low. So also maybe the issue is in the womb. So sometimes they don't succeed, that's for sure.
I think we have an illustration the PD is going to send us so that we see exactly what happens. Is it this?
This is about how the embryos appear before you put them in. So, and these are real. These are our real things, pictures we take from our lab. That's, for example, when this is the egg, the first one is the egg which has already been fertilized. We see there that it has been fertilized. It has those two nuclei inside there, nuclei inside. Then the following day they will divide, and then they keep on dividing. This is the beginning of human being. What you see here, actually, this
is exactly what happens when fertilization
this one resulted into a human being, that is for sure.
Okay.
So what you see here is a child already on the road.
Really?
But yes, so the cells keep on dividing and dividing until they reach that stage on day 5, and then we put the embryo inside. Yeah, so this is showing what we see in the lab. And this is real, yes.
So the most challenging stage is normally the 3rd or 4th stage when you're doing IVF.
Yeah, so where it depends on what is causing the infertility. Sometimes the problem can come at any stage. Sometimes some people, the eggs don't grow at all. That may be the issue, and you don't continue with it.
In the first stage?
In the first stage.
Where you're doing the therapy?
When you're giving the medication, the eggs don't grow at all. These are very nice eggs, yes, but you find eggs don't grow at all. You're trying to look for them, all the medications, you adjust the dose, you change the medication, no eggs grow. And this is probably because maybe the person has very few eggs, because we know the woman has a specific period of time during which she's having eggs, and maybe beyond that, the egg quality goes down. Yeah, so that is where it may stop. Or you may find that the sperms are not able to fertilize, so fertilization fails. Yes. Or the embryos are not growing well. Yes. So that also can be a problem. All these went well maybe, and when you put in the embryos inside, it didn't just attach for reasons which are beyond what you can see.
True. Thank you. Thank you so much,
So
Doctor.
it is very important for couples to know and to be able to talk with the doctor and determine what their chances are before they go into the treatment. It doesn't mean they cannot try, but they should be trying it when they know where they lie. Yes.
Thank you. A friend is asking that of late he took the wife for a pregnancy test, and they did that SCG test. It came out positive, but there is nothing. The doctors after that told them there is nothing in the sap. There's nothing growing. Yes, in the womb.
Yeah, so when so positive HCG, so HCG is human chorionic gonadotrophin. This is a hormone which is produced by the immature placenta. Even the placenta continues to produce this. Now, as the placenta is producing it, it spills over in the blood, and if the level goes higher, it can go over in the urine. So you can test it in the urine or in the blood, and it is an indication of pregnancy occurring. Now, this doesn't mean that the pregnancy is normal. It just means that there is a pregnancy. Whether it will progress into a baby and to other later stages will depend on other factors. Yes, sometimes the embryo is not very nice, so it does not. So you get the embryo getting arrested at a certain stage of development, and it dies off.
Okay.
Yeah. So a positive pregnancy test is good, but it's not the absolute thing only.
Doesn't define that the pregnancy
Yes.
Okay.
So usually after doing the pregnancy test, 2 weeks later we do a scan to see.
To confirm whether the baby is growing or not.
Yes.
Yeah. There's someone online, I think. Our lines are open. You can give us a call on the number. Sorry. Hello, caller. Yes, please. Good evening.
Good evening, doctor.
How are you?
You're speaking to Mercy in Kasuri.
Ma?
You're speaking to Mercy in Kasuri.
Margaret.
Mercy.
Mercy. Oh, yes, Mercy. Yes, Mercy. Please go on with your question.
Okay, I'm asking Doctor another thing.
Yes.
I actually not about fertility, but I just want to know when my cycle will return to normal, because I have been on appeal for over 8 months. But then I stopped taking the pill in November last year.
Okay.
I missed the December. But when I was on the pill, I was having my cycle that day.
Okay.
30 days.
Yes.
It was consistent. The 4 days were good.
Okay.
And the blood was normal. But then I missed December.
Okay.
And when it came in Jan, it came, I think, yesterday. Today I feel so much pain.
Okay.
And the blood is having some sort of tissue, like tissue like overload. I tried applying water onto the abdomen, like hot water in a bottle. So I was asking, like, will my days come back to normal, the fertility cycle, and also the bleeding, will it go back and like to normal? And also, when will I be able to get like ovulation that will lead to fertility, because I've been having an active sexual life.
Thank you so much, Mercy. Doctor's got you well. He's going to answer you right back.
Yes.
Yes, she has issue with her periods.
Yes.
Ever since she started using the pills and family planning. I think she's saying she got her periods in January, just this month. So those are issues. I've written them down. There's someone else on the line. Let's first pick the calls, then you respond at once. Bethan TV, hello.
Hello?
Yes, please.
You're talking to Viola.
I'm talking to?
Viola.
Okay.
Oh, Viola.
Oh, Pio. Oh, yes. Oh, Pio Leonard.
Leonard.
Yes, so Pio. What's your query?
I have some problem.
Please go on.
My wife, she got a pregnancy like on. Okay, she got miscarriage on like when it is now 2 months.
Okay.
Again, after she conceived. But now she's facing some problem.
What problems?
She's facing a problem around the umbilical. Sometimes she can feel it can come like something which is so swelling, and also can complain that it is paining.
Okay.
And then I took her for the scan. And then they told me also there is nothing, but the baby is what? The baby is okay. Now when we came back, she's still crying. Even up to now, she's still crying that the thing is. Even me, sometimes I feel like it is swelling. So I don't know what could be the problem now.
Thank you so much, Opio. Doctor has got you. He's going to respond to you shortly. Doctor, we have another, thank you. We have a message here. This is hello, this is Winnie. I've been trying to conceive over 2 years and I don't use anything like stopping pregnancy or any other thing. I always go through my periods monthly. I need doctor to explain what could be the problem. Yes.
So I think we can start with Mercy.
We start with Mercy, yes.
Mercy, well, if I can get her clearly, she said that she took some pills. I am thinking she was using them for family planning.
Yes, then she took long to get her periods. Yes, they came in January, and they are so painful.
Yes.
Besides that, she has clots.
Yes.
Will they normalize? How about the bleeding? The bleeding is still not normal.
I don't know if she's still taking the family planning, but this is a situation where she really needs to be evaluated, because it's possible when you're on family planning you could miss your period, or you could have a heavy period.
Yes.
But if you have it painful and maybe you have stopped the family planning and you're still having those irregularities, it's very important she gets evaluated first, because we really need to go to the core of the problem to find out what is going on in her. So she definitely needs to visit an expert in this area, and it should be evaluated.
Thank you.
Yeah, if her family planning was prescribed to her by a gynecologist, this is something which she can discuss with the gynecologist.
She needs to go back to where she
Yes, so the gynecologist should be able to help her clarify that. In case that's not possible, then she could go a further step to seek the opinion of this time maybe an endocrinologist.
Thank you.
Yes.
Thank you so much.
Yeah.
Mercy, I think you've got doctor. Kindly take time, get back to your gyne or the professional doctor who attended to you and prescribed to you all those pills or the family planning, so that he or she can know exactly what is causing whatever that you're going through. But you'll be fine, please.
Yes.
Don't lose hope. Thank you so much, doctor. And then Opio, the wife.
Yes.
The wife conceived.
Yes.
She has some swelling.
She has some swellings.
And they're painful.
And pain.
But every time he goes to the scan, they're telling him the baby is normal, the baby is okay. But shortly again, she gets the swelling. What could it be?
Yeah, so, well, the wife is pregnant. The pregnancy may be okay, but I think the wife may be having an issue. Now, this may not be sorted out only by the scan. She needs a real review by a real doctor, not just to go to the scan and do a scan and say everything is okay. Because when they do the scan, they are focusing on the baby.
True.
The mother is a complete person. The mother has a muscle and so on. All those have to be evaluated. Sometimes it could be a hernia, you know. It could be a hernia which is getting worse because of the pregnancy. Sometimes they have. The women have ulcers, yes, and some of the hernias may be hidden. Sometimes they have issues with the appendix, or it may be gallbladder problem. We've seen all this.
Okay.
So other diseases don't leave pregnancy alone. So they also have to be paid attention. Yes. So she needs to be evaluated. They should not only focus on the baby.
Okay.
Yes, that lady needs
so much,
an evaluation. Yeah.
Opio, wherever you're watching Bethany TV, please kindly take back your wife and follow the method that doctor has told you. Don't only rely on the scan. Get a professional doctor to go as far as evaluating the lady. She could be having some underlying conditions that you are not aware of. Thank you so much. Those were the two calls. Winnie is saying she's not using anything, but she has failed to conceive for 2 years now. What could it be? Yeah, so if she has failed to conceive for 2 years and she's staying together with the husband, there most likely should be a problem. It could be some issue with the tube, it could be an issue with her womb, or it could be an issue with even the man. With the husband,
yes.
Surely.
So she needs that evaluated. There definitely should be some problem.
Thank you.
Yes.
When you take time, please, and go with your husband so that you seek further medical attendance. This is, she's saying, hello, sister. My sister is 44 years old. The doctor tells her that her eggs are too weak to even be boosted. She's so depressed. Is there any other help you can offer? Yeah, so the quality of the egg in a woman, even the numbers, go down with age. With age, yeah, they go down with age for sure. But if it is no other problem, sometimes people who are confirmed to have low numbers of eggs actually do conceive.
as long as they take care of their body and they take care of their interaction with their husband.
Okay.
Yes, I've seen even some people where that hormone which they measure, the AMH, where it is negligible. I've seen some of them get pregnant. Except when that happens, they need support, hormone support, because their ovaries are usually not strong enough to support the pregnancy. So she needs to know what is going on with the other aspects of her reproductive function.
Thank you.
Yeah, the egg
Briefly,
is...
Doctor, there's someone dying to talk to you on the phone. Bethany TV, hello? Hello? Hello, caller.
The line is...
Have we lost him? Sorry, you can keep trying, keep calling. Yes, I think the network is not so stable. Yes, you were still telling us about hormone imbalance,
yes,
especially in that age.
Yes. So I was saying that even in a situation where the egg reserve has been pronounced to be low, if other factors are okay, with some bit of nutritional support here and there.
Exercises,
yes,
good health
some
habits.
people can conceive.
Okay,
yes.
surely.
But in case that fails completely, then those are situations where they have to go now for donor eggs. Yes, sometimes the egg numbers and the qualities are so low that you need to use donor eggs.
True.
Yeah.
True. Thank you so much. Though she didn't indicate the name. Hi, I'm Esther. We've been together for 7 years in marriage, but still no child. I was diagnosed with hydrosalpinx.
Hydrosalpinx.
At Kampala Imaging Center. However, I had a child while at the university. That's 10 years ago. But I'm married now. Everything has failed. I need your help, doctor. This is Esther.
Oh, yes. So what Esther is talking about, hydrosalpinx, is
What's
basically...
that?
So it's a problem of the tubes again. Now here the tube is blocked, but part of the tube is swollen. There's blockage behind here,
then another
but
swelling again.
yes, before the blockage, there's a swelling of the tube filled with water. Hydro means water. Salpinx is tube. So water in the tube usually is a sign of some infection which happened earlier, and then it resolved. Now that condition can stop somebody from conceiving. She might need further treatment, maybe for the hydrosalpinx, before she undergoes some other additional treatment. If the hydrosalpinx is affecting one tube, they could deal with it, maybe in terms of removing the hydrosalpinx, and one other tube can work for her. But if both tubes are involved, then after managing the hydrosalpinx, she might need IVF. Yeah. So I think in this case, she really needs to consider the options. 7 years is a lot of time, and this means this problem is significant. So she needs to see a fertility specialist as soon as she can.
Thank you.
Even if she doesn't have the money, she really needs to see so that she knows the real path she has to follow without wasting time.
True, because also her age is going 10 years.
10 years, yeah.
Thank you. Esther, thank you so much for still being with us. I'm glad that doctor has given you at least some solutions to the pending query. There is an audio. I think we are going to listen to it, then you can get back to the person.
Yes.
Ono Annette nga nsinzidde wano Nansana. Nazaalako omwana emyaka 2, oweta emyaka 2 nefuna olubuto. Kati wayiseewo ebbanga lya mwaka gumu n'ekitu. Nafuna olubuto nenzaala omwana, wayitawo ebbanga lya myaka 2 n'ekitundu nefuna olubuto. Ne luvaamu ku mwezi gumu. Kati wayiseewo omwaka gumu nga sinaddamu funa musawo ekizibu kiyinza vaawo. Era tubadde nsabako ku nnamba yo eddwaliro ly'okulamu lisangibwawo.
Thank you. Thank you so much. I think she's saying she gave birth some 2 years back, sometimes back. And then after 2 years, again she conceived, but she lost the pregnancy. But she has tried over and over again to conceive. Now it's a whole year. There is nothing coming up. What could be the issue? That is what she's inquiring. And she wanted your contacts and maybe physical meeting. I think you can come to Bethany Women's Hospital, Luzira. you get time and fix an appointment. You can't fail to find where the hospital is, and then you look to Dr. Underbat. He will attend to you. Thank you so much. I think you can as well answer her.
Yes, so she has had a baby before, and then she got another pregnancy, which ended up as a miscarriage.
Yes.
I don't know how old she is, but
but
most likely she may have had maybe a complication of the miscarriage, and the commonest is usually a problem with the tubes. Infection going into the tubes, and then the infection causes scarring. The infection eventually gets cleared off, but the scar remains. Yes.
And blocks the sperm from traveling to the other side.
Yes. So you can either have a complete blockage and then you don't have pregnancy at all, or it may be a partial blockage and you end up with an ectopic pregnancy. So in her case, that may be the line of events.
True.
And so she definitely needs to be evaluated in terms of assessing her tubes, and so she has to come over to the hospital and that should be evaluated.
Thank you. Thank you so much. We have another caller. We still have a lot of messages here. Caller, hello?
Hello.
Yes, please.
Good evening.
Good evening to you. How are you?
I'm good.
What's your name and where are you calling from? You are?
I'm calling from Orvaga, Barbara.
Yes, Barbara.
For me, I had a child I conceived in 2014.
Okay.
Early 2014.
Okay.
But also, let me use Uganda. Nafuna ko lubuto mu 2013. Then nenzala 2014. Naye lokufuna olubuto I was on medication.
Okay.
So then I conceived, because after 2014, I had a child in 2014 Jan, then I lost it.
Oh, sorry.
Then after 2014 up to now, I've never conceived again. So I don't know where the problem comes from. I don't know.
Thank you so much for your concern, Barbara. Doctor is answering you back. She conceived and gave birth in 2014.
And this is not having another pregnancy now.
Yes,
so yes, and I remember she mentioned that she had some medication first before
she has been on medication before even conceiving.
Yeah, so I suppose that may be some form of fertility treatment. Maybe she was having issues with ovulation. But 2014, that's about 9-10 years now. Like 9 years.
True.
So she needs an urgent evaluation, because she could be having issues with her tubes, so her tubes need to be checked. So also her ovary reserve has to be checked. So she shouldn't be waiting. She should come over and let this thing checked out, so that at least she knows the exact problem.
Yes, surely.
Yes, it could also be a problem with the man. It can happen. Yeah, so she has to really have this thing evaluated.
Okay. We have more and many WhatsApp messages, but as usual, we are going to keep them, please. Don't feel offended. Next week, Doctor will start with his questions and give you all the answers. Because of our time, we are really time bound. Doctor, our last segment, myth or facts? Yes or no?
Oh, yeah.
Yes. Number one, infertility is a mostly female issue. Yes or no?
No.
It is both?
It's both.
Thank you. Number two, male fertility does not decline so long as they are still sexually active. Yes or no?
No.
No. Thank you. Fertility is hereditary. Yes or no?
Some aspects are inheritable.
Okay.
Yes, like especially those where it is affecting the eggs or it is affecting the man's sperm.
Okay.
Some of them can run through families.
Thank you.
Yep.
Thank you so much. After 35 years, a woman's chances of conceiving drastically drops. Yes or no?
Yes.
Thank you. Excessive use of hot tubs and prolonged heat can affect a man's sperm count. Yes or not?
True.
Thank you so much. Lastly, lack of sexual intercourse can cause infertility.
No.
Thank you so much. Doctor, please give us your last word for all our viewers so that we can sign out.
Yeah, so my last word is when you have struggle with conceiving, don't kill yourself. First step is to have it evaluated so that you know what is causing that.
True.
And then you can go on with the solution. The solutions are available.
Okay.
I can confidently say that there is almost no cause of infertility that has no treatment. Yeah. And
Thank you.
Yeah. So,
thank you so
there's
much.
a lot of hope.
All right, Susan and the rest, we are going to get back to you next Sunday. Thanks so much for being part of us. This has been Medical Mind. Next week we shall be here the same time at the same station together with Doctor, bringing you yet another exciting topic as far as fertility issues reproduction, and other health-related issues are concerned. From me and the team, we sign out. Thank you so much. Sleep well.